Do you have sore shoulders, or you can't quite get that jacket on easily, or you've got neck pain that really triggers migraines or headache, or you just feel like you're really stressed and really caught up like this and there's so much tension in your shoulders? Well, we're going to talk about that right now. Hey guys, I'm Michael. I'm an exercise physiologist and health coach, and I've got 5 ideas about what we can do differently to help relieve some of this tension and stress in our shoulders and give ourselves more comfort when it comes to our neck and our shoulders and how we interact with life. So let's look at the basics a little bit, okay? The shoulder is actually the most mobile joint in the body. It needs to be because we need to interact with the world. What do we do with our arms? We lift stuff, we carry stuff, that's the shopping, the furniture, the kids, the grandkids. Um, we can go dancing with each other. We can do so much with these shoulders, but when we get older and maybe there's injuries that we collect, we can do maybe less and less. We might have a frozen shoulder, we might get bursitis, we might need to replace our shoulders, for example. So what we want to do is look after our shoulders now so that they're ready to look after us in later life when we need them to. Because certainly I've had many patients that have not had great shoulders, and it's been really tricky for them to go through life. Even to pick up a cup of tea, put a full kettle on to cook is challenging to hold that kind of weight out in front of them. So it really impacts their quality of life. So what we want to do today is take care of that quality of life. And as for your neck, well, it's no fun having a stiff neck. You know those times when you wake up out of bed and you're kind of stiff and you can't look over your shoulder very easily, makes driving difficult. You need to kind of twist your whole torso to get the seatbelt in the car. We don't want this. So what can we do to help our neck and our shoulders stay nice and mobile? I've got 5 things that we're going to talk about. Okay. The first one is see how you're going. See where you're at right now, and maybe do some mirror work. See how you go in front of the mirror. So I'll stand up and I'll adjust this. It's a bit down. Okay, so what we want to do is stand in front of the mirror so we can actually see, oh, my shoulders aren't actually straight. This one's a bit higher. That might be because of that previous injury, or it might be I'm always wearing a heavy handbag on this side. We just want to look at how quirky we are. We can also look side on, and this is what I do in an exercise console, is we look at the posture. Where's the shoulders? Okay, how's the rest of the posture? So go look at yourself in the mirror and actually see how wonky you might be. All of us are a little bit wonky, and that's okay. It's about working with our own particular wonkiness and trying to slightly correct that over time. Okay, so we also want to see how we move. Can I stretch up, or is this staying out in front? Does this not come out to the side? So how's our range of motion? Can we open up all the way? Can we actually get behind us? This is a good one for putting our arm into a jacket. It's also good for women to, can you get around the back to do up a bra? Or you're really restricted. You can try and do the old over at one side, up on the other, and see if your hands touch. We certainly want them to be within a couple of centimeters of each other. Ideally, they can get this close. Many of us can't even get, very, very close, but that's why we want to do some of these next things, which are the stretches. So often we've got limited range because our chest muscles are too tight. So you wouldn't think with shoulder pain and neck pain that we're talking about your chest, but actually your chest, your pecs are pulling in. Okay, so what we want to do is stretch out your chest. So we put our hands into the wall. We don't want our fingers to be vertical. We want them to be angled back. And I want to rotate out. You should feel it into your top of your shoulders, the front of your shoulders here, across your chest. If you feel too much of it in your bicep because your arm is straight, bend your arm a little bit. So you focus that into your chest. Now we don't want to be twisting our arm back this way too much. We really want to focus on opening our chest like this. You can also put your hands back behind you like this and stretch your hands outwards. And of course you do both sides. When it comes to our stretching, we want to do 15 seconds at least to 30 seconds or 60 seconds if you prefer, twice on both sides. So I've just stretched this side, I'd go back, I'd stretch this, and then this one and this one. So that's for my chest, okay? Another stretch to really stretch out our lats, these big muscles on our back. We want to put our hands onto a table, dining table, kitchen counter, the sink even. And we want to walk our hips back, walk our feet back, bend over. So it's like we're diving into a pool. We want to put our ears between our arms here, have a nice flat back. We don't want to be round like this, okay? Ideally, we go for a nice flat back. So my pelvis is rotating a little bit, is rolling forward to get that flat back. But the key thing today is in my shoulders. So really I'm doing this kind of movement, but then I'm moving my torso more this way to get a nice stretch up across here and down my back, my lats like this, okay? So this is really great for opening up this way. So those are our two stretches. We start there, but now we're kind of loose. We want to start moving, okay? So let me just go to my notes. The first thing is we want to make sure what it feels like to get our shoulders back, okay? A lot of us have our shoulders forward and we don't realize it. That's where a lot of this round back that you can see comes from, because my shoulders are forward. What we want to do is get my shoulders back and also bring my chin back. I don't want to leave my head forward like this. Many people do. You can see it's not in line with my spine. So I want to get my ears over my shoulders and my shoulders over my hips. I don't want my hips out here. I want to be nice and in line. Doesn't that look nice and straight? So if I have my arms straight and I push forward, I get a round back. And if I pull my shoulders back, but I keep my arms straight, I've got a nice flat back. You can actually do this against the wall. And it's kind of hard to see front on, but what it looks like is this. So right now I've got 1 point against the wall. Now I've got 2. So I encourage you to try this, okay? From here, I've got 2 points against the wall, 1 point against the wall. 2 points against the wall, 1. And what we want is our shoulders to be back like this, like all the time. This is what good posture is, having our shoulders back. And if we've got really tight chests, we're likely to be falling forward and it's going to be putting us straight into that round position. So we want to make sure our chest is stretched, getting our shoulders back like this. Now the muscles between our shoulder blades actually pull our shoulder blades back into the position that we want. So how can we exercise this? This is movement again. Put your thumbs up, put your thumbs out, squeeze back like this. Now I'm squeezing those muscles between my shoulder blades, and you'll hold it for a little bit, you let go. You can do this throughout the day whenever you're feeling a bit tight, a bit whatever. You can really just squeeze those muscles and turn them back on again. Another example is the wall angel. We put our elbows into the wall here and rotate up. Excuse me, Mr. Picture. And we do this kind of thing. Now I'm having to squeeze my shoulder blades together and against the wall to get up here. Some of you won't have the range of motion in your shoulders to do this, the external rotation, and that's okay. We want to focus on our elbows in and our hands go up, okay? They go up to as far as you can rotate them up to the wall. And we just want to focus on moving up and down. And over time, believe me, your external rotation will get better. You'll be able to get back to the wall and you'll be able to do this kind of stuff. Now I see in my film here that I'm a bit lopsided. This is another thing you could do in front of the mirror to make sure you're even. Really important to be symmetrical in these kind of movements. For myself, I broke this collarbone years previously, so I've always been a bit asymmetrical myself. Okay, so that's why it's really great to do this stuff in front of the mirror. So that's moving, right? Certainly in your shoulders, move it or lose it. Now with your neck, if we want to move our neck, think about 3 directions. Yes is up and down. No is side to side. Maybe is tilting. So think about yes, no, and maybe when we're moving our neck. Okay? Yes. And what we can do is stretching like we did before. Stretch all the way down, 15 seconds. Stretch all the way up, 15 to 30 seconds. Rotate this way, rotate that way. Try and put this ear on that shoulder straight down and straight down again, okay? We can also do one combination movement where we twist this way and we look down. We get a great stretch along the back of our neck on the side over here. So we go rotate out and we look down. Fantastic. And you do it on both sides, obviously. Okay, so that's moving. Now, of course, muscles that are tight like to be relaxed, and heat definitely does that. So in the shower, your Denka rubs, your heat creams, your wheat bags, these are fantastic to put on your muscles to help the tension go. Also, it's comfortable. It makes you feel good. Okay, and the key is here bringing quality of life to ourselves, feeling good, moving well. Now you can also use massage balls. Okay, I'm a big fan of this thing that might scare you. It's called a massage cane. If I'm trying to get round to this muscle and squeeze it, this shoulder needs to do all this reaching. So I'm a big fan of taking this and putting it over my shoulder, and my hands are nice and comfortable in front, and I can pull, I can push, depending on where that niggly spot, where that particular spot is that really hurts. Okay? Always when we're massaging with tools, massage balls, and especially this, a hard plastic, never on bone, always on muscle. This thing is also great for getting into all those difficult spots that we can't easily get to. So that's why I like the massage cane. Now, the last thing on my list here is exercise. Once we're actually feeling comfortable in our joints, in our muscles, in our movement, it's actually time to build on that. Exercise is all about progressive overload and making it slightly harder and harder for our bodies, so it needs to work slightly harder and harder, get stronger and better. So what's a good thing to do for our neck and our shoulders? Well, strength exercise. You could lift weights. I'm a big fan of kettlebells. You can get a cheap kettlebell for $30 that'll revolutionize your shoulders especially, but great for your full body. Or mobility things like yoga, Pilates. These kind of things can be really soothing for your mind. And actually that's the bonus thing that we haven't talked about. Why are we so tight? Why are we so tense? It's probably because stress. There's a lot of stress in our lives, a lot of stress in the world. A lot of us, it goes straight into our shoulders. We get this really stressed kind of posture, full of tension. So if we engage in some yoga, some mobility practice, maybe some breathing exercise, some meditation, we're going to have less stress and be more relaxed. So, hey, that's a couple of things that you can try out if you've got some pain and some stress and tension in your shoulders and in your neck. I'd love to hear how you found these things, what your favorite one was. My patients have had great success with all of these, and I'd love to hear, pardon me, how you find them too. All right, leave a note in the comments below, and I'll see you in the next video. Thanks, guys.